hypoglycemia is a common presentation, one which is often missed. And in the case of hypoglycemia, often we may not be able to reach a diagnosis, and that may have a lot of disastrous consequences from these hypoglycemic disorders, and we'll carry forward from that perspective. Uh, you can all go and have a look at our website, where has got a lot of information, including resource in pediatric endocrinology, e-learning platform, our courses which are there, including fellowship and pediatric endocrinology programs, our grand rounds, our journal clubs, and other activities which regularly happen. Our books, which are available both online as well as the hardbound version, our mobile application, which guides. As we all know, GSD is a genetic metabolic disorder of liver with defective glycogenolysis and gluconeogenesis both in GSD type 1. Defective glycogenolysis but intact gluconeogenesis in GSD type 3, 6, and 9. And defective storage of glycogen or glycogen formation in GSD 0. There is also defective enzyme which converts galactose or fructose to glucose, and they are converted to unwanted glycogen stores like lactic acid, fatty acids, uric acid, which is harmful, and therefore there is risk of hypoglycemia during the periods of fasting. There are two types of carbohydrates: complex carbohydrates, which takes longer time to digest, like bread, cereals, grains, rice, pasta. Simple carbohydrates, which digest easily, like glucose, galactose, lactose, fructose. Therefore, our diet should include more of complex carbohydrate, and it should be less than 5 grams of simple sugar. Total fat intake should be 20%. Why do you want to restrict the amount of simple sugars? So because of postprandial hyperglycemia immediately after. So what will it cause? You may have hyperinsulinism. You don't want that to happen. So if your body is having low sugar, so insulin is adjusted in that regard. If your sugars goes even slightly up, you will have immediate hyperinsulinism. Something like when you treat hypophosphatemic rickets, if you give too much phosphorus at one time, what happens?
If we give too much phosphorus in hypophosphatic rickets, the phosphate will inhibit
the phosphorus goes up.
Phosphorus goes up. So
PTH comes in.
PTH will be increased.
It will wash it out.
Okay,
so here, if you give too much simple sugar, you'll have hyperinsulinism, which is going to wash off your hypoglycemia. So that's why this is important. In this point, you want something like a slowly releasing. So if you can get a depot preparation of glucoside sort of a thing, that will be a better phenomena in that regard. So you say just go back. This is the most important point. So you're saying bread, cereal, grain, rice, and pasta. But usually they will not have enough to sustain. So problem happens at night. It's not that the daytime they can feed 4 hourly. That's not a big problem. But night is a major problem. So, but these things, do you think they will take care till 12 hours? So often patients with diabetes say in the night, my sugar, when I say it was 120, morning also it was 130. So despite taking insulin, so how did that sugar go up? Because of hepatic release of. So hepatic glucose production is a major thing. How much does the liver produce every milligram per kg per minute, do you think? 4 to 6. 4 to 6. So this is such amount. So 4 to 6 milligram per kg per minute. If you translate that, now this is how you can work out is how much grams you will need per day. That is the amount of, and particularly in that 12 hours, because that's very, very crucial. So that your bread, cereal, grain, pasta may not be able to do that. So of course, delaying your feed will become important. Incorporating them may be important. How else you can increase their duration of action? So for the same carb, how can you prolong the duration of action? Is by decreasing the glycemic index. How do you decrease the glycemic index? If you take only a bread, or if you take a fried bread. Fried bread will be longer acting. If you have cheese on that, it will be longer acting. So adding protein and fat may prolong that. So that is something also which is there. So taking a milk sort of a scenario may be better. Giving a glucose will be very hazardous because that will have very high, low, very high, very low. That is something which is avoided. So carry on. Fat requirement is 20% of total daily calories with equal distribution between monosaturated, polyunsaturated and saturated fats. Cholesterol intake should be less than 300 milligrams. So again, this is a sort of a double-edged sword. Your triglyceride is very high, so you don't want to give too much triglyceride. But still, if you don't give fat, your glycemic index may become very high. So this is something which is there. So we will counter that with the next part, protein.
The goal in GSD is to maintain normoglycemic state in between meals. So we can have cornstarch. In infants, there is a limited amount of pancreatic amylase production, which helps in digestion of uncooked cornstarch. Therefore, in infants, it is preferred in daytime to have frequent feeds, and in night, nasogastric tube feeding is preferred using enteral formula or glucose polymers. In more than 1 years, we can use raw cornstarch with a dose. In children less than 2 years, being 1.6 gram per kg every 4 hourly, and more than 2 years with 1.75 to 2.5 grams per kg every 6 hourly.
How do you get this cornstarch?
So there is a pack available pack.
So it's easily available. It's basically like it's used for various preparation. So it's not available as cornstarch. It's available as corn flour. It is available as corn flour in the market. If you go to the supermarket or the grocery store, they'll give you corn flour, which is available. So this is very, very important. NG feeding is the treatment of choice. It is like your continuous pump sort of a scenario, but that is not easy to identify. So this becomes like your land test. So you can say cornstarch is like a long-acting insulin, while that is like an infusion of insulin. So that is a better way. But then having a NG feed continuously monitored and you don't have any aspiration, all those issues have to be considered.
Therefore, the allowed sugars are glucose, dextrose, dextrin, maltose, corn syrup, aspartame, acesulfame K. Sugars that are not allowed or are limited in to be consumed in limited amount is fructose, galactose, brown sugar, sucrose, maple syrup, or raw processed sugar.
So we already discussed that fructose really comes through the different pathway. And the other thing about fructose is what does fructose do to insulin?
Increases.
It is a more potent stimulus of insulin than glucose. So fructose is something you won't want to give too much. That can cause more problems in terms of insulin release.
Fructose and galactose should be less than 2.5 gram per meal. Uh,
Yes.
Fruits contain fructose, should be consumed in moderate amount. Milk and milk products contain lactose, should be used in limited amount. We can use unsweetened soy milk, and since the consumption of milk and milk product is limited, we have to supplement child with calcium and vitamin D. Sugary drinks should be avoided. Sugar-free tea, sugar-free drink can be taken. Artificial sweetener have sorbitol, they should be avoided as they get converted to fructose. In GSD1, the main role is of raw cornstarch. It acts by hydrolysis and digestive tract and releases glucose molecule. It is slowly digested than other complex carbohydrate. Provides 30 to 45% of daily calories. Prepared by dissolving in lukewarm water and shaking the container well. It should be mixed with fluid just prior taking it. Should not be mixed with spoon, as the cornstarch will stick to the spoon and child will not receive the correct dose. It should not be heated or cooked because it will break down. And meal should be consumed prior to taking cornstarch because it will make child feel full. Because the duration of action of cornstarch is 4 hours and it requires at least one feeding in the middle of the night, the extended release cornstarch was developed. Using structural modification was done. Waxy maize starch known as glycosate with duration of action of 7 to 10 hours. It advantages was that middle of night feeding was omitted and there was improved sleep and quality of life. Disadvantages being a strong taste of corn and increased abdominal pain, flatulence, and diarrhea. In GSD 3, 3A is inability of liver and muscle to break down glycogen to glucose, and 3B is inability of liver to break down glycogen to glucose. The lack of glycogen access in muscle leads to muscle damage. Therefore, a high protein diet with low carbohydrate diet like modified Atkins diet is preferred in GSD 3 with protein requirement being 3 to 4 grams per kg per day. Advantages, it has been seen in various studies that it improves cardiomyopathy and avoid tissue deposition of abnormal glycogen. In GSD 2 and 4, there is no specific diet available. GSD 5, simple carbohydrates can be used. GSD 6, frequent carbohydrate meals or cornstarch to be used. And GSD 7, low carbohydrate ketogenic diet can be used. The monitoring of blood glucose and ketone is essential to determine the optimal balance of protein and cornstarch in patients.
You can all go and have a look at our app, which also has a hypoglycemia interpreter, which will help you reach the diagnosis, our courses, as well as our platform.